All right. I want to talk about tests that you should consider doing because the conversation keeps coming up with some individuals that they ask me a good question. They're like, "How come when we do testing, it comes back normal?" And repeatedly, it'll come back normal. Everything looks okay. You're fine. You're fine. You're fine. You may not be feeling great. You may be feeling like something's off, that something hasn't been the same for a while. And then you're like, but my blood work's fine. I go to the doctor. I went to emerge. I had an episode of this or that. And they're like, you know what? We can't find anything. You're fine. So you can follow up with your family doctor. You do that, do some tests, and everything's clear until it's not. So that's the frustration, is that people are trying to be proactive. They're trying to figure out what they should be doing for their health to, prevent diseases, to get to the bottom of why they're not feeling great. And things are getting missed. So maybe we can come up with a few ideas or tests or protocols to put into place so that you are being proactive. You are catching things before they develop into a problem. So it is kind of standard practice that everyone gets CBC, complete blood count, and usually you want to try to add in a few other things. Typical physicals around here. If you're able to do it yearly, that's great. A CBC, complete blood count, will let us know about any kind of blood issues regarding your red and white cells, immune function, anemias, that sort of thing. It's sort of a very broad screen, which is good. But a lot of times, if there's something going on for a while, often it takes a long time for the blood to actually show that there's something not right. So that's why you try to be a little bit more specific. And if you're complaining that you've been feeling really tired, sometimes they'll do your thyroid. They'll do your TSH, the stimulating hormone, which, to be honest, unless you have a really specific thyroid condition or disease, most fatigue doesn't really get explained by the TSH. And sometimes if your iron is okay, maybe not optimal, and your B12 is okay, maybe not optimal, so now we don't have a solution. We don't know why you're tired. And the worst passing excuse is that it's age. That should never be an explanation, because I know 80-year-olds, 85-year-olds, 90-year-olds that are very, very active and feeling good, and age wasn't a factor. And I've had people as early as 30 tell me, well, I guess I'm just getting old. And that just doesn't make sense. So now you got to go a couple levels deeper. So if you're not feeling well, the first thing you want to think about is, well, when did I start not feeling well? Has it been a while? And has it been ever since something, whether it was an acute illness, an injury, an accident, a stressful time? And sometimes that alone can be an indicator or prompt a change in your overall vitality and energy, so that you just don't feel well. And sometimes it is mental, emotional. Sometimes it is a little bit of depression that has crept in, and you're bummed. You don't have the get up and go like you used to. You don't have the motivation. A lot of people during COVID was a big, kind of like a big downshift for a lot of people, because all the things that they were doing before, their social network, their outlets, their exercise, their sports, their appointments, all that stuff got sabotaged and was ended. And the majority of people have not picked those back up. And probably because it's just, once you get out of a habit of doing something, it's really hard to get back into routine. And when you get, bummed and bored and call it lazy, it's not really laziness, but lack of motivation and lack of drive. Once that occurs, then it's really hard to, pick that back up. And now you're behind. And there's a lot of people that in the last few weeks, they've been saying like, well, I think I'm going to start my gym membership again. I've been meaning to do that. And then they won't because the holidays are, before you know it, they're here. And then in January, they'll be like, well, now is the time I'm going to get back on it. And some of them do. Some of them they'll say, well, I have, something at home. Work's busy. I'll work out at home. That rarely works because unless you've got a schedule that really accommodates like a sweet spot in the day, you're not going to do it because you shouldn't be waking up crazy early to do it. And you shouldn't be staying up late to disturb your sleep. That doesn't work. But back to the testing. If we can break it down to systems, let's say, okay, well, this is what I would do. If someone says, I'm not feeling well, I would identify what symptoms. Pardon me, I got all these messages. Let's take it back a step. If we want to understand why someone's not feeling well, I would want to know the constellation of symptoms. And by constellation of symptoms, it means everything that you feel that you probably don't think is interconnected to something else. Now, I don't want to say like, oh, I hurt my arm and my ear's ringing and that somehow they're connected. Not at all am I necessarily saying that. But a lot of times people will be like, well, you know what? I noticed a change in my periods. They've been really heavy the last year or so. And I've been feeling tired. Well, I mean, that kind of sounds like a straightforward anemia. And then they'll be like, and I've also noted my hair has been thinning. Could also be a sign of anemia. Could also be a sign of a change in your diet, maybe lack of nutritional state, low iron for sure. Then they'll be noticing some acne. Okay, now we're starting to see like maybe some male hormone overproduction in this individual because they got the thinning hair. Maybe their DHT is high. Their periods are, being a little bit more aggressive. Their skin is seeing some of the negative effects. They're feeling drained. So if you do blood work for your hormones, your female hormones, more often than not, at this level of symptomology, they're not going to show abnormals. They're going to look okay. You've got to be almost pregnant or almost in menopause. Well, you can't be almost pregnant. You got to be you have to be pregnant or in menopause for those blood levels of hormones to show significant change for the most part. PCOS can also show a little bit, but there'd be other markers too. You want on its own, estrogen, progesterone, LH, FSH. That's not going to show you much. It's going to make sure that you are ovulating, and it's going to make sure that you're not pregnant. So then what? That's where we come in. I would do the Dutch test, the urine catecholamine analysis. So when you have all the breakdown byproducts of every sex hormone and your stress hormones, you get a very, very nice picture of what's going on internally, chemically. And with that information, then you can start using some more targeted and more gentle approaches, different modalities like herbal or supplementation or acupuncture. Now, a lot of the times, if there is something hormonal, your MD may go with birth control, which will probably override and correct some of the stuff that's going on symptom-wise, but it doesn't fix what is skewing the system overall. And what does that mean? If your body's not producing a hormone, giving it more of that hormone doesn't necessarily correct the reason it wasn't producing that hormone. And I'm suggesting that sometimes it's a nutritional thing. It could be a lack of certain nutritional components or elements. It could be a change in your internal constitution. Could be a reflection of your diet. It could be a reflection of stress. It could be age in that case. So finding out more information with what's available to us, because we have it. We could measure these things. Why do a test that is inconclusive and will give some generic results when you can use something that's much more specific, individualized for yourself, scientifically proven, and will give you the opportunity to treat the concerns in a much more natural and therapeutic state. I like it. Makes sense to me. So that's an example of not feeling well and using appropriate testing to understand why. Now let's go with like a much more severe example. Let's just say someone's like really not feeling good. Like they've lost weight. They're not doing okay. They're weak all the time. Appetite's dropping, weight's dropping. I mean, it sounds severe. It sounds bad. Right? It sounds like a type of cancer or something. But they'll go to the doctor. They'll get blood work. Everything's normal. And that's the frustrating thing, because, you know, you kind of, in the back of your mind, you want it to be okay. You don't want to find out that there's something severely wrong. But at the same time, you also want to get an answer. You want to get a solution so that you can fix whatever is happening. That's where I think it's important to have a practitioner look at the constellation of symptoms. I think that's going to be the name of this podcast, Constellation of Symptoms, and defining what that means. Symptoms, especially symptoms that are of recent evolution within the year, rarely do they happen in isolation of each other. If you develop this and that and that, they're somehow connected. They may not be directly connected anatomically or physiologically, but if you've got weight loss, loss of appetite, numbness, shortness of breath, double vision, there's something happening internally that's like, we need to investigate. And sometimes it does require being pushy with your healthcare system to get imaging, get answers. So I'm not leaving until I know what's wrong. And sometimes there is nothing wrong. Maybe it's just, you're just not feeling good. Maybe there is stress. Maybe you're just not digesting well. And that's why I think it's important to address with all my patients their state of diet and state of digestion. Because there's too much misinformation with what a good diet is. People think that, I eat good. And then you go through a diet log with them and you're like, you're skipping breakfast and you have a carb-heavy lunch. You may have some snacks or treats or something crummy in the afternoon. You have a really, really dense dinner. And you may crave or snack after dinner. That's probably like 70% of my patients when they first come in. That's the most common outline of a diet. They'll have like one really good meal. They'll have a half a decent lunch, which meaning some days they have leftovers and they're conscientious, or they pick up something relatively healthy, or it's just like takeout or junk or nothing. Breakfasts are hit and miss. People who have breakfast usually have decent breakfasts, or they don't eat it at all. And when people start to gain weight, because when you're young, you can skip a meal and not really notice the price. But when you reach a certain age, it's not forgiving. You skipping that breakfast and maybe pushing lunch, the energy crashes are going to come and the weight gain to go along with it. And people don't get that. They're like, I'm gaining weight and I eat less than everyone around me. I hear it so often. It's because your metabolism has shut down. So that's when we use the InBody. The InBody bioimpedance machine is great to show if there is an increase in visceral fat. Visceral fat is the fat around the organs. And the number one contributor to fat around your organs is inappropriate fasting. Second place is insufficient protein. I don't want to go into the specifics and details on that, but when someone does their in-body, I know when they're suffering the effects of poor dietary hygiene or poor dietary routine. The other component is the inability to digest protein. I can't say it enough. People need more protein and they need to absorb more of the protein that they're consuming. A digestive enzyme with betaine hydrochloric acid is critical. I'm starting to think that if there was just one supplement I would get every person to have, I could only pick one, it would probably be betaine. Just to enhance your stomach's ability to digest what's there in the food. And we have this false belief that if I eat a meal that I've done my job, it's done. It's in me, it goes where it has to go. Unfortunately, it's not the truth. It's not reality. You can have the most nutritious meal right in front of you. If you lack the enzyme activity and the lack of stomach acid, you are not going to assimilate that nutrition. Whatever is easy to assimilate, carbohydrates, that's the predominant fuel source that's coming in. And if it's in a surplus, it's going to get stored. And these are the people that are getting frustrated because they're making the effort. And once we introduce the enzyme, in their in-body analysis, their muscle mass starts to go up and their body fat starts to go down. I say it's like a teeter-totter. As body fat decrease or as muscle mass increases, body fat will go down. You don't need to diet. If anything, you should be eating more. The average person should eat at least 1,500 calories per day. Now, there's a little caveat, meaning you should be somewhat active. That doesn't mean exercise every day. Active, moving, not idle, sitting down for 14 hours a day. So I think that's important. And to round it out, I think we all need to do like a self-check. You need to kind of feel like, where am I lacking? What can I be focusing on? What can I be working on? If your body composition's good, if your diet is good, if your blood work has been good, if you're going to the washroom regularly, if you're getting good sleep, if your hormonal cycle is on track, if there's nothing that you can pinpoint and be like, you know what, I've been feeling this for a while. If you can't put your finger on a symptom, you're probably doing pretty good. If you're not feeling any chronic pain, there's nothing that you're like avoiding or like trying to close your eyes to and be like, I don't want to think about that because it's stressful. Outside of those checks, if there is something that needs to be addressed, address it. Because half the time, it's probably nothing. Some of the time, it's a check engine light, meaning you're still functioning, everything's good, there's no illnesses, but it's like a preclinical warning, meaning our body is trying to respond and there's resistance or stress or an obstacle or a shortage of resources. We can totally wipe that out. We can correct that. So be vigilant as far as being conscientious about your health. Don't be paranoid. And if there's something that's bothering you, talk to us. We can fix it. We can identify it. When I do live blood analysis, it gives me a lot of good information. People look at it and the TV's behind me and they're like, oh my gosh, is it bad? I'm like, nothing that we can't fix. So let's remove the stress and the anxiety from it. We can be proactive. We can get people healthier. And it doesn't take that much. It just needs to have a very specific, targeted approach and a logical approach. We have resources, we have tests, we have programs, we have therapies available to address the concerns. So let's not delay.